All right, let's take you now to KwaZulu-Natal in KwaMashu, to be exact, and this is near Durban, where a new public health facility is set to be opened today. The Dr. Pixley Ka-Isaka Seme Memorial Hospital will be officially opened by President Cyril Ramaphosa. Let's get some detail on this. And Karinda Jagmohan joins us now. Karinda, good morning to you. It is a momentous day for the people of KwaMashu, I should think, because as they would put it in KwaZulu-Natal, Umtholampilo is one of those important facilities that they need to have access to in order for them to heal their ailments. How's it feeling on the ground?
Certainly one of celebration, Oli, because this hospital will not just serve the people of KwaMashu, but of course the greater Durban area, specifically the Ink area, over 1.5 million people who previously had to depend on one hospital closest to them, the Gandhi Memorial Hospital, but now they have what is being described as a state-of-the-art facility. So I'm joined by our KZN Health MEC, Namagugu Simelani. Thank you so much for speaking to us, MEC. Tell us about the critical need for this hospital and the absence of such a facility for the people of KwaMashu previously.
Thank you very much, Karinda. This facility actually caters for the people of the area that we call, it's now called Pink, because it's Phoenix, Inanda, Newzroom and KwaMashu. Now that is a very big area, and it's an area that was previously only catered for by district hospitals. Now if you understand the level of services that are at a district level and regional level, those are two different service of care. It means that specialists that are at a regional level were not necessarily available at a district level. So we took a decision as this provincial government that we needed a regional hospital that will be in this area, because this area caters for more than 1 million people. So you needed actually a regional hospital so that you don't refer people to town, you don't refer people to Prince Mshien, which is more than 20 kilometers away. So when you have this facility or this hospital, you are in essence providing a service to more than 1 million people in the community that needed that particular service.
Of course, the President is expected to come here today. When we look at our KZN health facilities, now including this hospital, how do we stand when it comes to comparison to other provinces in terms of our specialty hospitals and the number of healthcare providers and facilities that we have?
Well, we like to believe as a province that our services or our healthcare special services are a bit more higher than other provinces. Of course, we are a bigger province, so we would be expected to have specialized hospitals that are more than other provinces. We compare probably to only Gauteng in terms of the numbers of specialized hospitals that we have. Of course, we only compare to Gauteng in terms of the population that we have, but we do believe that at this moment, we are doing quite well when it comes to specialized hospitals. Of course, right now we are working on a central hospital that we are going to be building, or that we are building in the north of the province. That will take us a couple of years as well. But when you look at the nature of the province, you realize that we need to decentralize services as much as possible.
Indeed. So, MEC, in the run-up to this launch, we have seen some protests calling for insourcing of workers, employment of local workers as well. What have the challenges you've experienced been like, and how have you addressed them?
Well, protests that were calling for insourcing were not genuine, because right from the beginning, this is the one hospital where we insourced everything. So there was nothing that was ever outsourced. And the challenges that we originally had, and I think could have been some reason for people to complain, was the employment. We had 1,400 posts in this hospital, and we had more than 600,000 applicants. So it goes without saying that only 1,400 people of KwaMashu would have been actually employed at the end of the day, out of the 600,000 that actually applied. So a number of people would complain to say local people have not been employed, which is not true. It's just that the number is not at the level of unemployment in the community. So challenges that we've had in relation to that. We've had some people who are insisting that they should be given work in terms of tenders, but this hospital actually does not run on tenders because, like I said, we have insourced everything. So the only challenge really was the challenge in respect to employment, but we have really done our best in ensuring that people of KwaMashu, Inanda and Durban are employed. But I always remind communities that this is not a KwaMashu hospital. This is a hospital of eThekwini. This is a hospital of the province of KwaZulu-Natal. Because when it comes to your nurses, your doctors, your professionals, you can't ask someone whether you come from KwaMashu or you come from Durban and only employ those people. So we have tried that at a level where, the entry-level posts, we try to get as many locals as possible. But when it comes to professionals, we had to be professional in our recruitment.
And lastly, MEC, for clarity, can you just confirm the cost of building this hospital and any plans for expansion?
Well, the hospital, it cost us close to 2 billion rands, and I'm sure when you walk around you will see that it is worth every penny of that. In terms of expansions, as yet we are not planning on it. Of course, we have a challenge when it comes to accommodation of our staff, but that is something that we can discuss, have a PPP with the private sector, or, people can go and get somewhere to stay. We are in an urban setting after all, so it's not like it will be very difficult to get accommodation. But in terms of expansion so far, we think we have not thought of that yet.
Thank you so much for your time. Of course, she's about to go meet with the ministers, and we're waiting for the presidency to come. And there you have it, just about 2 billion rand for this hospital that will serve over 1 million people in the pink area. So that's Phoenix, Inanda, Durban, KwaMashu, and she says the greater eThekwini. It does have various specialized departments. And as I stand here as well, you can still smell that new hospital chemical smell. It is quite a state-of-the-art facility, as we've been taken on a tour of the area, but we're also going to speak to the Public Servants Association to see, what issues they might have, if any at all, as well as some of the new employees, like the doctors that are just passing us by now.
Karinda Jagmohan, a momentous day indeed, covering the opening of that state-of-the-art hospital, and that's the word that will continue to be used for some time to come. It is a great day indeed for the people who live near KwaMashu.